HealthySimulation.com Simterviews. How has your institution responded to COVID-19?
So we have taken advantage of the disruption of COVID to reevaluate what are we doing, how are we doing it. My biggest advice for those that are in charge of simulation programs is don't accept the idea that you're non-essential. Plan for not when COVID ends. Plan for how do we keep this essential element of safety and quality moving through COVID as safely as possible for the faculty and staff that teach in the simulation environment, as safe as possible for the participants or students of simulation.
Initially, the Sim Center was closed. After 2 weeks, I petitioned infection control to let me reopen. So what we did was we trained 450 outpatient nurses to be ICU nurses to take care of COVID patients. The challenge really is, maintaining a safe work environment for everybody and ensuring that our COVID policies and procedures are adhered to so that we can stay healthy.
We did a lot more podcasts to get out some more information and try to share some tips and techniques. It was so difficult trying to get some of the things that I wanted to do online. And I think the pandemic made that push for us as we're planning our research with our scoping review and our survey down the line. We're doing all of this to really study, can we achieve the same learning outcomes online that we can in person, and how to best do that.
And in March, we shut down pretty much. Camels, like everybody else, shut down their operations. And during that time, we created efficiencies, safety protocols in anticipation that we needed to be able to open. Because I think, as I mentioned, there are critical things that need to occur for training. And we knew that we had to create an environment which was safe for our learners, our staff, our faculty. We had to be up and running and ready to go when it was time to go. And so we worked really hard with our team over March, April, and May while we were running the TGH training. We opened our doors in June and we were extremely successful. We had no cases during June, July, and since we've been very solid in our safety protocols with COVID. We redid our strategic goals and priorities for the annual year, the fiscal year, because of COVID. And my number one priority was safety, right? Over revenue, over everything else, it was safety to our staff, learners, and faculty.
We have done a lot of innovation around serving that need for simulation training without brick and mortar centers. How do you deliver simulation by proxy? So we came out with a product called Distance Sim, which allows an instructor to go into a brick and mortar sim room, even if their students can't be there. And the student can remotely be right in that room with the instructor, seeing through the cameras, seeing everything happening in the room, and directing a proxy to take actions on a hands-on physical exam using a mannequin or whatever tools they might be using. So when you can accelerate these timelines and get these products fully developed, fielded, and deployed, then there's no limit on what we can do in the future.